Hello everyone. Today we are going to talk about gastroesophageal reflux disease. If you suffer from heartburn, acid indigestion, trouble swallowing, feeling of food caught in your throat, and other problems, you are likely to have gastroesophageal reflux disease. Food travels from your mouth to the stomach through your esophagus. GERD can irritate the food pipe and cause heartburn and other symptoms. After watching this video, you'll be able to understand everything related to GERD, its causes, how to diagnose and treat it. Our role today is to answer most of the questions regarding gastroesophageal reflux disease. Today we have Dr. Kim, who is a laying doctor at Chun Hyang University Hospital in Seoul. He is going to discuss with us everything about gastroesophageal reflux disease from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases.
Now let's talk about GERD. What is GERD and how does it occur?
GERD stands for Gastroesophageal Reflux Disease. And as you can see here, this is the esophagus, and this is the stomach. Along the route where food passes from the esophagus to the stomach, there is a certain part where high pressure is maintained. But if the pressure becomes weak here, food may pass through the stomach and then reflux back into the esophagus. Various factors may cause this part to become loose, resulting in gastroesophageal reflux.
What causes it exactly?
To understand why this disease occurs, you have to take a closer look at its anatomical structure. There are conditions under which the typically high pressure over here becomes weakened. For example, when you eat too much or when the pressure in your stomach builds up, the food will fill up and reflux when the conditions are right. If you are obese, the pressure here, part where the food passes down from the thorax to the abdomen, increases due to the rise of the abdominal pressure. So gastroesophageal reflux will occur more easily. Also, there is a muscle that holds pressure over here like this. And if the muscle weakens like this, gastroesophageal reflux will be more likely to occur. In addition, when the esophagus is filled with food, it should be sent down quickly like this. But if such peristaltic functions are impaired, gastroesophageal reflux can occur easily. In fact, there are a myriad of causes. It is quite complex and difficult to explain. Anyway, it can be said that when this part becomes weaker, gastroesophageal reflux occurs easily.
Does it have any symptoms?
The most common symptom results because of stomach acid, which presents a burning sensation in the chest, as stomach acids keep hitting the chest and refluxes upward. The second symptom is feeling that food keeps coming back up. Third, your voice may be husky, or you may feel a bit of hoarseness in your throat when you wake up in the morning. Other symptoms may occur, such as frequent dry coughs. This occurs because food refluxes over to the respiratory tract while sleeping. And such frequent coughing could be said to be one of the symptoms of gastroesophageal reflux.
What are the treatments out there for GERD?
First of all, medical treatments. By suppressing gastric acid secretion through drugs, it is possible to reduce the amount of gastric acid that refluxes. In addition to drug treatment, correcting dietary habits and lifestyle is crucial to therapy. The reason why GERD, G-E-R-D, happens is that, in fact, we live standing up, so it's not easy for the food to pass up through. Besides, the pressure is normally quite strong here, so it is difficult for food to pass through. But if you lie down right after eating, this is what happens. Then, if you lie down like this, the food keeps coming up no matter how strong the pressure. Eating a lot of late-night snacks and sleeping right away, overeating, drinking a lot of coffee, caffeine, smoking, and on. All this contributes to weakening the pressure over here. By correcting those factors, the symptoms may be improved.
These advices are the same to prevent it, right?
Yes.
Okay.
Today, the doctor explained in details everything related to gastroesophageal reflux disease. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as we can.